Before treating hyperpigmentation in the treatment room, it's essential to assess the condition of the skin in relation to things like barrier function, integrity, and pH balance. If the skin is out of balance, the acid mantle may be stripped and barrier function compromised. Treatments to improve the condition of hyperpigmentation could potentially exacerbate the condition, particularly in the case of post-inflammatory hyperpigmentation. So where do we start? A thorough consultation is key. Do you go through your consultation with purpose? Your client doesn't need to know the ins and outs of melanogenesis, but as a therapist, you should have a good understanding of the process so that the questions you ask actually have a purpose. Treating hyperpigmentation without an idea of the root cause may end in disappointment for you and the client. Checking for possible hormone imbalances, the most common being estrogen and progesterone. A client may not know they have a hormone imbalance. For example, during pregnancy, the increase in estrogen levels can cause hyperpigmentation on the face, called melasma. Treating melasma while pregnant is not likely to improve the condition, and you should wait until after pregnancy when the hormones hopefully level out. Sometimes it can be a permanent situation. Is there an inflammatory component? Has the client spent time in the sun without protection? Perhaps on several occasions. Remember, even if there's no erythema evident, there could be an underlying inflammatory component. Medications can trigger reactions that stimulate overproduction of melanin. Be the detective. No, we're not medical professionals, but having the information and thinking like one may just help provide the best treatment outcomes for your client. And I don't need to remind you, we do not diagnose illnesses or disease. A verbal consultation gives you keys to why pigmentation is occurring, but a hands-on visual consultation will give you clues to the overall condition of the skin. Use of a magnifier and a Woods lamp are useful tools to have in your toolbox. So if we're looking at epidermal pigmentation, it will appear brown when looked at with the naked eye, whereas dermal pigmentation appears darker and may have a grayish tinge to it. If you're using a Woods lamp during your skin analysis, epidermal pigmentation will appear darker than the dermal pigmentation.